In today's health alert, Wayne County has reported its first West Nile virus death. It's also Michigan's second death from the virus this year. So far, the state has reported 17 human cases. So joining us now is our chief health editor, Dr. Partha Nandi. And Dr. Nandi, what can you tell us about this case?
Well, Linda, first of all, my condolences to the family. This death involved an older adult with underlying health conditions, which unfortunately put them at higher risk for severe illness. Now, West Nile virus, spreads when an infected mosquito bites a person. The mosquito itself gets the virus from feeding on infected birds. So what happens is that if a person gets the West Nile virus, well, most people actually don't develop any symptoms, but 1 in 5 may actually experience flu-like symptoms: fever, headache, joint pain, vomiting, diarrhea, or rash. Now, in rare cases, right, it can cause serious problems, something called encephalitis or meningitis, both serious conditions that involve swelling and inflammation of the brain or spinal cord. It can also lead to coma, convulsions, which are seizures, and vision loss, numbness, paralysis. Severe cases can be fatal, and particularly in people over 60 and those who have chronic conditions like diabetes, high blood pressure, cancer, kidney disease, or a weakened immune system.
So, Doc, after a mosquito bite, when should someone be concerned, and what steps can people take to protect themselves?
A super important question. Where symptoms, Linda, usually develop 2 to 6 days after being bitten. Now, most folks with mild illness get better on their own and recover completely. However, fatigue or weakness, well, that can sometimes last weeks. Those with severe illness can take longer to recover, sometimes several weeks to months. And some effects like memory loss, hearing problems, trouble walking, muscle weakness, or depression, that could be permanent. It's important to get medical care right away if you have a high fever, severe headache, neck stiffness, muscle weakness, confusion, or tremors. Your doctor can run tests to check for West Nile virus. Now, what about prevention, right? There are simple steps you can take. First, use EPA-registered insect repellent. Wear long sleeves and pants. Avoid being outdoors at dusk and dawn. That's where you can get bitten the most, right? And get rid of standing water around your home where mosquitoes can breed. Also, make sure doors and windows have intact screens to keep those darn mosquitoes out. Now, these steps work really well, and they're important because there's no vaccine or specific treatment right now for West Nile virus. The risk is highest in late summer and early fall, so right now. So please be vigilant because, this can be fatal, so we have to take it seriously.
We do. Thank you, Doc, for that update. Appreciate that. If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook. We'll get it right to him.